For this computer. All right, everybody. I am so excited here today because I'm doing this solo dolo. My partner, Walter Aka, periodontist down in Texas, has left me. And that could be a dangerous thing when you leave the house unattended. So, my name is Leroy Horton, as all of you know, and I am so excited because I've got someone who I've followed for a number of years and watching her journey. And I will tell you first off, she's a soon-to-be full-fledged periodontist, so near and dear to my heart, right? We're on the same team.
Yes.
But she has an amazing content, and we'll give you all her social media and contacts so you can follow her afterwards. And I don't want to mess this up. Your first name is pronounced Airy or
Aierress. Like an heir
Aries.
or an heiress.
Okay, Aierress Hannah. I've been pronouncing your name Airy this whole time.
It's
I'm
okay.
so
All
sorry.
right.
But Dr. Aierress Hannah, soon to be periodontist, welcome to the show. How are you doing?
I'm doing well. I'm sorry. My maiden name is on my screen. This is like my Zoom from school. My last name is actually Davis. So that's why I go by Dr. Air Davis because it's short for Aries, all the things. But I'm doing great. I'm so honored to be here. I've been watching you and following you for so many years.
Thank
Anytime I see an amazing periodontist, especially Black periodontist, I'm like, hi, I'm Aries. Nice to meet you. Want to connect? I have questions. So I'm super inspired by your journey and really happy to be here finally.
Well, I appreciate you. And as I'm following you, I saw you had a post, so I want to ask you something. Okay.
Sure.
Pues veo que tienes un viaje planeado a Colombia, ¿sí? ¿Estás aprendiendo español con
Un poquito.
Duolingo? Un poquito? So
Sí,
you going to Colombia?
I am going to Colombia.
Okay, okay, so just tell me. All right, please, if you're going, tell me it's for pleasure and you're not coming back with full veneers or different body parts than what you went with.
Oh, babe, if you know
What's
my
in
my
Colombia?
social media, you know I'm not going to get any veneers. Absolutely not. That's not going down. I'm going for pleasure and pleasure only.
That's what's up. You know, that seems to be the go-to spot for a lot of Black professionals.
Mhm.
I got a number of buddies that go to Colombia all the time. One's actually married to a Colombian. His wife's Colombian, and obviously they go back home. But what is it about Colombia that's kind of been on the map lately for us to travel to?
Sure, my husband has gone several times before me with friends, and every time he comes back, he loves it. He's like, I had such a good time. It's so beautiful. I really want you to go. So this year, I'm wrapping up residency, kind of using the last couple of few of my days. We're deciding to go for Valentine's Day, so he's taking me, and
That's
hopefully
just
I come back and I have the same feeling about Colombia and want to go more frequently too. So I'm
right.
excited.
So it's Black people friendly,
Yeah,
what I gather.
my husband's a Black man. And he goes with his
That's
Black friends and
that's
they enjoy themselves.
that's what's up because not everywhere that we go to is friendly, but I'm
Very
glad that
true.
we've got a couple spots that we can go and be ourselves and be accepted. Sometimes more than we're
Exactly.
accepted here, especially in this
Yeah,
in this climate,
unfortunately. Unfortunately,
right?
and I love like my Hispanic patients. I took
Mhm.
a lot of Spanish classes like when I was in high school and college and stuff. So I can like understand it a lot better than I can speak it. And I
Yeah.
really appreciate like my patients who speak absolutely no English. I think that it's just so brave of them to allow me to render treatment on them and they don't necessarily fully understand what I'm saying. So I really try to make it a point to like, pull out a translation app or Google Translator or like try to talk to them and explain to them like, this is your diagnosis, this is what we're going to do so they feel comfortable. And they're some of my best patients. So I'm excited to go to Colombia and try to like improve on my Spanish speaking and maybe I'll come back and be fluent, who knows.
It's amazing how much patients appreciate the effort,
Hmm.
right? You ain't got to be fluent, but if you
Right.
show that you're trying, it makes them also feel more comfortable because sometimes they might be hesitant to speak or to
Yeah.
express themselves for fear of how they'll sound. But
Right.
when you sound equally as courageous to use a different language, it kind of gives them that boost of confidence, which is
Yeah.
awesome.
I love that.
So tell me about, I know you just finished your boards, which for anyone listening, of all the specialties, perio is probably the most literature intensive.
Mhm.
So not only do you have to master all these different surgeries that you're going to be doing, you have to do that while memorizing studies from, Greenstein studies from the 60s and
Yeah.
70s and so forth, to be able to quote them on demand, right?
Mhm.
How has that experience been for you?
It was tough. Residency really unlocked a new level in my dental experience. Of course, dental school is not easy for anyone, but I felt fairly confident in dental school. I was kind of like always ahead of my class and things like that. But in residency, it was like a whole new world. Like I felt like I got picked up and dropped off in another country and they are speaking to me and Sullivan and Atkins and Zucchelli and Cordelina. I'm like, who are these people? I've never heard of them before in my life. So it was really hard for me to adapt at first. And I'm a really nerdy kind of person. Like I like to read a lot. And I also appreciate the history behind things. So I think that's what resonated with me with perio is being able to kind of like look at it from a perspective of like this is where we've come thus far and like appreciate the classic literature in that way versus just like being mad that I have to remember an article from 1958. So it's better now as a third year. I look back and I'm not done yet, but I just look back on my first year and a half and how hard it was for me. And now, like, I can cite literature. I feel so much comfortable. Obviously, I still have a long way to go, but I feel great about it. I feel really confident about my exam. So prayerfully, I passed.
No, I'm sure you passed. I have no doubts
Great.
in that. And yeah, I mean, you have a long way to go, but you've also come a long way, right? I
Yeah.
mean, being a specialist is 4 years of college, 4 years of dental school, whatever gap years or GPRs or anything you did in between, then another 3 years for perio. So you've absolutely come a long way. And so I always want, especially younger doctors, to really be able to do better than I did at sitting in the moment and
Yeah.
really appreciating their own hard work. So even though you're looking forward, I can look at your past and say, "Hey, Dr. Davis, you did that."
Thank
You know what I mean?
I
You
appreciate it. Thank you so
you
much.
you did that. So what are some of your favorite procedures so far that you've done?
Oh man, so I really do enjoy treating disease, as in like seeing a patient come in with high bleeding or probing deep pocket depths and really making a unique treatment plan for them and maintaining that relationship for them to see like it's gotten better, for them to come in my chair and I see like, oh, you're brushing better, and they tell me all the dental products that they purchased. So love that. I love GTR a lot. I really like lateral windows. I just enjoy the challenge of them. It's like really anxiety ridden, but like I think I'm getting more comfortable manipulating the sinus. So that's great. And believe it or not, I've had a couple good cases with periimplantitis where we use like LaPip protocol and just different approaches. Of course, it's so unpredictable, but I kind of appreciate just kind of having better discernment of like what case do I need to try, not try, what am I suspecting to get. So yeah, just honestly, I just love perio. I'm really, really happy and blessed that, I was able to gain access to this specialty. And I'm just excited to like continue to use my platform and impact patients and share what can actually be done because people just know so little about perio. So I love
You
it.
know, that's what's up. And for the non-dental folks on here, this is how you know someone is extremely smart and talented because they'll use certain words like lateral window and LaPip just so casually in their vernacular. But for anyone listening that's not in the dental world, lateral window is a surgery in the sinus,
Mhm.
right? That is such a delicate surgery because the sinus is literally half a millimeter, the sinus membrane, half a millimeter thick. So one slip of the hand, one
Mhm.
tiny, your assistant bumps you with the suction,
Oh
it could
yeah.
end the entire surgery. So this is the skill level that we have within our culture. Okay,
Yeah.
when we talk about our black dentists that we're celebrating, and
Come
then
on.
obviously LaPip is a laser therapy, so that's
Yeah.
dope that you guys are getting trained on the Millennium Laser.
Yeah,
So
love it.
as you've been doing this, have you noticed any comparison from yourself to say maybe the actual dental students that you're working with in your ability to kind of see three-dimensionally the whole patient start to finish? Like, are you at the point where you're looking at a patient and your brain is already creating a treatment plan and seeing the end result?
Mhm.
Tell me about that.
100%. I think that one thing, I went to Meharry Medical College for dental school, and one of our faculty members, Dr. Tyus, will always tell us, he can teach us and give us the foundation, but he can't teach us how to see. And I think that with dentistry and with the practice of dentistry, your vision becomes better, it becomes more detailed, it becomes more of a bird's eye view. But then as a specialist, you're able to kind of zone in on your area of expertise and like all the tools in your arsenal to treat a certain disease. And what I love about perio specifically, I remember coming into residency, I'm thinking whew, great. I could leave all that restorative and that ortho and that all that behind and just do perio. Yeah, but it really is foundational and it reaches and touches all specialties, and you have to consider all specialties. So, and that's beautiful. At first, it was a challenge for me, but I think that it's beautiful. It always makes me a lifelong learner to know like I am very, well versed in perio and I can share that, but I can still continue to learn from an orthodontist or learn from a prosthodontist and have even better predictability of my outcomes. So I think dental student air is probably really blown away looking at perio areas like, wow, like you know all of that, how did we get here? But I'm happy about it, and ultimately it works out for my patients in the end. So that's what matters.
That's what's up. And you've
Yeah.
come this far, not just by yourself. You've got
Right.
a whole family.
Oh yeah.
You mentioned your husband.
Yes.
You got a son, right?
Yes,
Is
I
it
have
just
them
one?
hidden in the room. If you hear some kicking and screaming, it's because I'm like, I'm recording right now. You have to be quiet. It's content time.
I've been there. So what was that journey like doing all this? Because it's intense. Um,
Yeah.
but then you also have a family that you have an obligation for time, love, affection, and energy. How was that
Mhm.
for you?
It's a struggle. A lot of times it's so funny. For residency, I applied twice. And the second time that I applied, I actually externed 2 weeks before I had my baby, and then I interviewed 2 weeks after I had my baby. And during my
Wow.
externship, my program director didn't know I was pregnant till the second day. And she like busting the opportunity was like, "You're pregnant?" I'm like, "Yes, but I'm fine. I'm okay." I'm in my head, I'm like, please don't deliver it here. They will never pick me if something happens. But I just think that it's just a testament to strength. I think becoming a mother really showed me how strong I can be. And it just gives me another purpose and reason, like being a dental student and grinding nonstop and focusing on getting to dental school and all the next level, you get really tunnel vision and all you're thinking about is just your professional life. But then you have a 3-year-old that shuts your laptop when you're reading lit and wants to read Paw Patrol. And you have a husband that, my husband isn't in dentistry at all, but he coaches basketball. So he wants to
Mhm.
watch a game and talk about plays. And I think that just like brings you back to reality and keeps me grounded. So
Right.
it's a challenge. And I know that as a Black woman in dentistry and a mom and a wife, sometimes, people can look at that as like not necessarily questionable, but like, oh, she probably can't show up because she has a baby and this and that. But luckily, I have the support system that they know my dreams, they know what I wanted to do, and no one's deterred me from that. And that's why I'm able to be a couple months away from being a periodontist. So,
Indeed.
yeah.
Yo, shout out to Black women,
Yeah,
especially Black women in dentistry and
that's
specialty
right.
residencies, because it's a different strength, right? I've had
Yeah,
kids through all my training, but I have the luxury of having a supportive wife and a
yeah.
supportive, my mom, my in-laws.
Hmm.
But there's a different requirement that, especially when you have kids, that the children have of the mother
Yeah.
than they do as a father. It's been kind of socially programmed. I can spend time away and the kids are fine. But if the
Mhm.
mom is away, it's like,
Right.
you know what I mean? So
Exactly.
for you to do all that, that is awesome. I absolutely
Thank
applaud
you.
that.
Yeah, it's definitely been a struggle. I'm not gonna let anybody watching this think it's easy, but it's well worth it. And now my son's 3 and he's like, "Mommy, you're a dentist? You have on your dentist hat?" and stuff like that. And I'm just like, he watched me study and he's like, "I'm proud of you" and stuff. So I'm like, yeah, it's worth it. You just have to wake up really early. That was my cheat code. Like I became a morning person. I wake up at 5:30 to get that time before for myself, for the lit I didn't read that I need to read before I go in, for all the things. And then once everybody's up, then, life starts working. So you just adapt and adjust.
No, that's what's up. Listen, you're living by example. And to steal a quote from our friend Bridget White that you did an episode with years ago, sometimes we are the ancestors,
Yeah.
right? So the work that you're doing now, your son is seeing, anyone that's looking up at you is seeing. And whether you know it or not, 50, 60 years ago, your legacy is going to live on because someone that's young is peeping you right now and being like, yo, I want to be that. You
Yeah,
know what I mean?
that's awesome.
So,
That's the goal.
but but you mentioned you're a black female doctor
Yeah,
and it's Black History Month, so we can't be
that's
remiss
right.
talking about the experiences of being black in a space that's almost usually, outside unless you went to an HBCU, but you're not an HBCU now, right?
Right.
Being in predominantly white spaces,
Yeah.
being a woman, a female in these spaces. What are some of the challenges, and then what are some of the strengths you've actually drawn on from that history of being a Black woman?
Oh man. In my program, I'm pretty sure I'm the first Black resident in the past like maybe 15 years, somewhere around there. But not really surprisingly, but a lot of our staff are Black people, Black women, and things like that. So I receive community from that. But I think that it's really challenging to be in a space where like your perspective isn't always understood or appreciated. And I feel like for me, I came into my residency program knowing that it had been quite some time since another Black applicant had been there. So I felt that responsibility of leaving the door behind me. I felt like whatever impression I made in my 3 years here will be the reference point for the next person that applies that may look like me or have a similar background for me.
Yeah.
And sometimes that weight is really heavy. Like when you're in lit and you feel like, or in anything, you feel like you're being challenged more than someone else for whatever reason, or you feel like you put forth a certain amount of effort and it's just seen as okay, but someone else puts like little to no effort and it's seen like this grand thing. In your mind, that could be for a multitude of things, but as a Black person who's operated all these spaces that were predominantly white, we kind of tie it to like, okay, well, what's the difference between me and everybody else? We all have the same degrees here. Some of us have more degrees than others. Most of us have the same experience. What's so different? So I can't say that my program has not welcomed me because my program is pretty diverse, which is a big reason why I chose the program. Just specifically as far as African American applicants, I don't think there's a lack thereof. There's just been a lack of applicants that have gone to my residency in particular. So it's like motivated me because I know like when I went to AAP for the first time in Austin, so many people were trying to like look at my badge, like, are you the hygienist? Are you the office staff? Are you the like, who are you here with? Like, hi, I'm Dr. Davis. I'm like, nice to meet you. And then we'll see like Dr. Cecil White or like my classmate Corinthia Wilkerson. She went to Harvard for perio. And like when we see each other, we see each other. So it's like but having that pride and making that connection within the circle of periodontics, I love that. And I'm really proud of that. And I'm proud of like all the comments I get from sharing my journey. And I'll get a Black female dental student who will text me and be like, hey, I think I want to do peri. I'm a second year. Can I talk to you about it? Absolutely. Like that's what matters to me because sometimes you have to see it to know that you can do it. And that's what happened with me. Like one of my mentors, she's a periodontist in Atlanta, Dr. Mari Barnes. And I went with her for a day and saw her life. I was like, oh, wow, I think I could do that actually. So it's really hard and it's challenging because you want community and you want people to understand, but you feel like you have to put on this, persona. Like, because one thing about me too, and I may go on a rant, but I'm really big on being myself. Like I'm a dentist, I'm very smart, I'm a specialist, but I can never lose Aierress. Like I was always Aierress first. That doesn't mean I'm gonna go in the operatory and sing Beyonce and do the dance. Like, no, that's a serious space, but I'm never gonna let anybody rip me of who I am. I'm gonna find a way to creatively bring that into my field. But it is hard, and I think that just being yourself and staying true to that will influence the next generation. And hopefully that 4% of Black dentists can be 8 by the time I retire, and I'll at least be happy in that.
And a lot of people don't understand because when we emphasize the importance of representation, right, and being the greatness of being a Black dog, the significance of it, it's
Mhm.
not just to have numbers for numbers' sake, right?
Right.
It's to influence the education, the perspective behind the treatment and the research. It's
Hmm.
because we see the majority of our Black population,
Yeah.
right? So they tell us to pull ourselves up by our bootstraps, right?
Hmm.
So when we say, okay, well, we need more Black doctors, oh, why they got to be Black?
Right.
You know what I mean? Because
Yeah.
we're the ones coming back home, right?
Exactly.
Right.
Hmm.
So that being said, I know that you have a couple soapbox issues that I want to touch on because being that you're such a genuine person, right?
Yes.
And I applaud, let me preamble that. I'm all about the preambles here. Because I've watched you and I've seen your content, and you got a following, and it looks like you got some sponsorships going on because I see you with,
Couple.
you know, right? Um, a lot of people will take that and be very protective of their brand to the point where either they overuse a gimmick, like I'm going to be the dancing doctor or I'm going to be the bikini doctor, right? We
Yeah.
see a lot of that, right?
Yeah.
you've been very authentic. And I
Mhm,
think that that is so dope because we see all aspects of your life with still a heavy focus on what you're doing academically.
mhm.
But I know you got some truth to tell me today about how
Oh,
you feel.
100%.
So, um, the first one we're going to talk about is veneers. All right.
Ooh.
So we joked about you going to Colombia and coming back for veneers. So the first type of veneer I want you to give me just raw thoughts on
Mhm.
your composite nail tech done veneers that seem to be the craze in our community. What is going on with that?
Oh my gosh. Do you have time? I don't want to keep
I,
you here all night.
we got time.
Um, so listen, and I have to preface this by saying I am not a veneer hater. Okay. I think veneers are beautiful. I've seen great work done with them. And when they're indicated, they're a great treatment modality. But two things as it pertains to the veneer tech situation. So I was introduced to that through TikTok. Yes, I've known people do backyard dentistry all the time or basement dentistry, whatever you want to call it, like braces. But to see people actually allow people to file their teeth down with anything, whether it be a nail file or a Temu ordered dental set, let them do that in the back of a barbershop or wherever for 29.99 is crazy to me. And I think that people, when this whole thing happened, a lot of people commented and would be like, oh, I'm a hater. Dentists are just mad because we're taking money. And I know that dentists get this bad rep of being scammers. And I really think it's because we all practice dentistry in a different way. Now, are there some doctors that may over treatment plan or what for whatever reason? 100%. And that's true in any profession, in my opinion. But the reality is it's more of a health concern. Like me, I'm a periodontist soon to be. I'm not going into dentistry to do veneers. So me making a video telling you not to go to Teeth by Tisha isn't going to impact my pocket because I'm not going to be the one doing the case. But the fact that I see
Wait,
most,
is that a real place?
that's a
Teeth
real
by Teeth?
person, Teeth by Tisha. I kid you not. I think she may have actually followed me on TikTok and I made videos about her.
Oh, I'm sorry. Keep going. I'm sorry. Keep going.
But yeah, no, seriously. And no shade to her, but all shade to her. That's dangerous. And you don't really know what to do and what to manage. That's the beauty of being a dental professional. We don't just throw 4 years of our life away to understand what to do if the prep is too deep or if it can't be a veneer anymore. We don't do that. And on top of that, after those 4 years, we don't know everything in the world either. But at least we have that 4 years worth of context to be able to navigate those situations. Going to someone who got taught by someone who's currently sitting in the county jail is not it. And I
That
will
is
say that to the end of time. So it frustrates me because I see our community impacted the most. Not to say that I haven't seen people from other, racial backgrounds impacted by it, but I take my profession very seriously. I love dentistry. I want to be a dentist since I was 14 years old, and I make the sacrifices to do so, not so that you can go to the back of the barbershop, but so that I can direct you to the right place and, things. And on top of that, sorry, I'm on my soapbox.
Oh, keep going.
Everyone is not a candidate for veneers. Okay. So just because you want a Gucci Mane smile does not mean you need a Gucci Mane smile. Okay.
Preach. Preach
So
it.
it's just like, and then you're upset about that, right? You go to one doctor who tells you, no, you don't need veneers. And now he's a scammer. He's the worst person in the world. You go to a basement. No, you can get multiple opinions. You can get multiple treatment options. Like I tell people, it's your mouth. It's an investment. It's like going to buy a car. Like, don't be like me. I'm kind of an impulse buyer, but most people shop around when they go looking for a car and a model and this and that, and they save for it and they prepare for it. Like your smile is an investment. It's one of the most important direct access to the rest of your body. It's associated with so many different components of your body, and your smile, you're using it every single day. So you don't want, and then on top of that, I'm sorry, because now I'm telling you, I'm on my soapbox.
I'm
A
loving it. This is
lot of
good.
these people are young, okay? And when you're
Yes.
so young trying to get these botched cosmetic services, people don't understand the difficulty it is to get a great anterior implant. Like that aesthetic zone is very technique sensitive. And if you put yourself in these compromising positions, you already don't even brush your teeth twice a day, but you feel like you deserve a Gucci Mane smile. Now that's going like, it just compounds. And then you're mad when
Right.
you're 40 and now you have a $20,000 dental bill and you're like, I don't have that money, but you were willing to risk it for $1,000 with Teeth by Tisha. That doesn't make
Right.
sense, you know?
Right.
That's
Poor,
just my
poor Tisha. Poor Tisha. She is getting it today.
teacher. I gotta put a name on it, but that's just my message, you know?
No, that's no, I'm 100% in agreement with you because it does seem like there's a compulsion, especially in our community, with
Hmm.
deals, right?
Yeah.
Anywhere we can save a little money, I mean, and think about it. We all been there, right? I remember getting stuff out of the trunk of a booster at the 7-Eleven when I was in high school, whether it was,
Right.
burnt CDs or the
Hmm.
cologne and
Oh yeah.
clothes and all that.
Right.
So that is a problem. But we also have what seems to me anyway, is me injecting my opinion, an epidemic of veneer dentistry in
Hmm.
the legitimate terms, right?
Yeah. Yeah.
Now, like you said, it's a very viable treatment. If done right, it can look great. It's not usually it's not a forever thing, but it can last a long time. But
Hmm.
I'm seeing a lot of before and afters where the before is gum disease, malpositioned teeth, and then it's just veneers. No ortho, no periotherapy, no nothing.
Hmm.
What is your thought on the legitimate veneer game and how that's become like the new thing, whether you're an influencer or you're trying to build a brand for yourself? Seems like I see a lot of veneers that may or may not be needed by actual dentists. Well,
Right.
how do you feel about that?
I think that a lot of people can sometimes, and I may be biased in this opinion, but I think sometimes people underestimate the severity of periodontal disease. Sometimes it goes a little under diagnosed. Sometimes people underestimate the need for incorporating specialty care because they want to kind of deal with everything under one roof. Patients are really like they want a popcorn strategy. They're not trying to get stable, go through ortho. They're not trying to do this comprehensive thing, even though the stability of that long term is a lot better for the patient versus a really quick fix. And I think as far as social media is concerned, in the dentistry realm, it's really heavily dependent on like before and after. Like, oh my gosh, look at this, look at that. A quick, nice video and things like that. And it's really gimmicky. But we know as, specialists who study science and look at things long term, the impacts and the implications that can have. But the patient doesn't know that. And you can't let a patient lead your treatment. Like I'm really big on that. I like to be honest with my patients and of course it's their mouth at the end of the day. But they don't understand the complexity sometimes that's going on in their own mouth. And yes, you may want one thing, but how can we figure out the best route for you to get there and be stable and do something you can keep up with? I really don't
Right.
believe in you doing a full mouth of veneers on somebody and you're scraping the calculus out, like their oral hygiene is not where it needs to be. Give them some time to just get better at that before you take that treatment route.
Right.
So yeah, I think that is really like influenced by society and patients and a multitude of factors. But I really hope that our dental community can kind of get back to comprehensive treatment planning and like understanding that we have to rely on each other to give the patient the best result.
I hope so too, but I feel like that's not flashy. That's
Yeah.
not sexy, right?
Yeah.
Taking your
Don't
time and
sell.
evaluating. And let me
Yeah.
ask you this. So I have patients that, especially as I've gotten older, where they'll come and and so they have something in their mind. Doc, I want this, whether it's veneers and implants, so forth. And as I do my workup, whether it's their health history, their oral health, their occlusion, their periodontal status, and I say, you know what, you're not ready for this. This would not be a good idea.
Yeah.
And you have a lot of other pressing needs. And they'll say, yeah, but doc, I just want to replace this missing tooth. So I'll do that stuff later. I'm at
Hmm.
the point in my career for a while. Well, I just say, well, I can't do it for you.
Hmm.
If you shop around, I guarantee you're going to find someone that'll do it. But I
Yeah.
want to do something that's in your best interest.
Yeah.
Do you feel like, because I feel like as I've talked to doctors, a lot of them, as I point things out when they post like an implant, but then on that panoramic, you see bombed out teeth and
Yeah.
vertical defects.
Yeah.
And when I ask, just a mere question, I'll DM them, not to put them on blast. I'll say, hey, what about, oh, well, we informed the patient they said they didn't want to do it. Where do you
Mm.
draw the line between what the patient wants to dictate
Yeah.
and what you feel is proper standard of care or sequence of care?
I think that, granted, I'm just starting my perio career, so I haven't had the motivator of like money behind me because I think that kind of really influences a lot of things for a multitude of reasons. But I haven't had the influence of money. I also haven't had the pressure of like producing and having like a boss that's like, you need to do X, Y, and Z. So for me, I'm very clear on like, this is what it is and this is what it ain't. To put it, we're comfortable here talking. Y'all don't say it to the patient that way, but like, you are not going to force me to put an implant in your mouth. You have stage 4 gum disease. You know what I'm saying? And I'll try to like, and I'm really big on meeting the patient where they are. I think that's so important in dentistry, and we lose that because we're so like, we're doctors and this and that and respect me. But like, if the patient doesn't understand what you're saying on a fundamental level, they can't accept your treatment. And I think that making it unique to the patient and not just like a one-stop shop, and letting them know like we have to work together to get to this point, and bringing them in on the treatment, I think personally from my experience has influenced the results. Now, have I had patients that are like, okay, you told me I have furcation involvement and my teeth falling out, but I want veneers? I'm sorry, Mrs. Adams, it's just not gonna happen. And I take the same route that you take. Like somebody will do it. Unfortunately, that's just the reality of it. But I think like my brand to me is very like important to me. And I'm not gonna jeopardize that and do something with intention. And I look at patients, especially with Perry, we do like a lot of older patients and things like that. I look at them as if like they were my grandmother or my mother or my aunt. And like if in my hands, would I do this to my aunt? Would if I know this isn't gonna work, if I know this is bad outcome, would I do it just to get no, I wouldn't. And I'll tell them if it were my mouth, like in residency, you want to get every implant in the book. You want to get all the reps in. There are patients that come and they're like, the student didn't really explain to me what all my options are. And I'm like, well, you can get a partial, you can get a bridge, you can get this. And they're like, well, I really don't want to do implant surgery. I'm like, well, go ahead, start with the partial, see how that works for you. If you like it, you may love it. It's not a problem. Like I think not being pushy and really letting the patient feel like they're getting, they have all the control, but really you're guiding the conversation. I think it makes a difference. But I know when I go to private practice, not necessarily the financial part, but there are going to be people that are going to try to tell me what to do in their mouth. And I'm just like, I have to stay planted on that. I only want to do what's predictable and what will make you better, not worse than you were when you came to see me, at least that I can
No,
control.
that's awesome. I'm so glad to hear that because I personally feel like there is a lot of financial pressure for
Hmm.
young doctors.
Yeah.
And they kind of hide it under the guise of, well, I informed the patient and this is what the patient wanted,
Right. Right.
right? But speaking of gum disease, because you mentioned that it's foundational, which is such an important word, right? So many people have gum disease, so many people have, you know, history of gum disease, but it's been treated, it's stable. But then there's so many that it's been untreated or it's been, for lack of a better word, neglected or ignored.
Mhm.
What are your thoughts on, let's say a patient comes to you and because the very last doctor in the long list of doctors that they've seen referred them to you because they said you need a periodontist. And now
Mhm.
you're in a position to let this patient know that, well, in fact, it looks like you've had this for a very long time.
Right.
And they look at you dumbfounded, like, well, no one said anything to me. I've been getting my cleanings twice a year or once a year. How do you handle those situations? And do you feel like it's as big a problem as I may feel?
Mhm.
Maybe because I have to see it all the time. But what are your thoughts on that?
Um, so I just think that it's different because you get the patient where it's like they know they should be getting their teeth cleaned more than once a year. And they want to come in and they're like, well, I think I had a deep cleaning before. And they know. So it's like, okay, well, let's get back to square one. I always tell my patients it's never too late until it's too late. And I'll let you know, like if that tooth is hopeless, if it's going to win, then it's time to, come reality. But before that, if you're starting, patients always think their mouth is just the worst thing in the world. And most of the time, it's really not as bad as they think it is to be. So I try to like motivate them for that. I try to like just drop in some vocal anesthesia, while I'm doing this, like, oh, beautiful, oh, great. Like, it's a couple areas here that we're concerned about, but over here, you're doing great, to kind of motivate the patient. But I think as far as neglected perio is concerned, again, I think it's people that try to keep things in house for whatever reason. They kind of want to underestimate the need for specialty care and think that they can manage things and control things in their own practice, which no, I don't knock anyone, if you want to try to do that there, but the patient should be first. And I think that if a patient came and was like, well, I've been getting my cleanings, why didn't anyone ever tell me? I would just encourage them, well, we can start here. I'll work collaboratively with their office. Maybe we can alternate recalls, things like that. And, because I'm a big person that's not one that's going to badmouth the dentist. Like, even if the patient tries to, like, that's just ethics. I'm not going to do that. I may have see some questionable things, but I have some concerns there. I'll reach out to the doc myself, but not to the patient. But I think that patients just don't understand that, like, they don't know what they don't know. And they
Right.
treat their teeth something separate from their body a lot of times. And I think when you break it down to them and talk about how it's all interconnected, like, I ask patients many times who haven't been to their primary care physician, like, have
Yes.
you been treated for diabetes? Is that a history for you? Like, to push them to go get that kind of treatment and those things. So it's amazing how much, and I'm in residency. So obviously I see a fraction of what I'll see in the real world, but I worked for a year. So I did see like a lot of disease that was just
Mhm.
untreated and people were just getting cleanings twice a year. And I think patients feel bad about having to get cleanings more than twice a year because in their mind, they're like, oh, you're only supposed to go twice. And I'm like, no, it's just like a maintenance routine. Like, beauty is maintenance. You get your nails done most of the time, like, treat it as such. Like, it's like you're taking care of your body.
Right.
So I think it's really big on patient communication and also communicating with your colleagues and people being okay with referring to a specialist, like not thinking that you'll never see the patient again because that's what the patient needs.
And I'm so glad you brought up the oral systemic connection because since I finished my period program, I have an AccuCheck in my little
Mhm.
mobile cart.
Yeah.
Any patient that I suspect hasn't been to the doctor in a while, I see is overweight, complains of sleep apnea, has high blood pressure, you know, I always just say, hey, you mind if I check your blood sugar real quick? And when I tell you, it's alarmingly common that I'll find someone who's, fasting, blood glucose, if they're being honest on when they ate, will be like 160, 170.
Yeah. Hmm.
But do you think it's a matter of, as far as the doctor and the neglect, I don't want to say anything disparaging per se, but because I've been in a number of offices where I'll point it out and I say, hey, this patient that is finally coming to see me, it looks from the records here, they've been having 6, 7, 8 millimeter pockets for years now. Oh, well, we did a deep cleaning 6 years ago. Right? Okay, but you still had deep pockets. Well, should we do a deep cleaning again?
Mm.
Right? So for the general dentist that might be listening to this and the non-dentist,
Mhm.
does the deep cleaning cure gum disease?
Absolutely not.
Okay.
Absolutely. I would have got that question right on the board. Absolutely not.
So it's important that even if they get the deep cleaning, they get
Right.
reval, and if there's still deep pockets, they come see Dr. Aierress Davis to
Hmm.
to get that foundation right before we do any
Yes,
more,
we want
right?
stability. It's a lifelong treatment, which is fine. You want to keep your teeth for life. It's so many people that think, oh, I'm just gonna have dentures when I get older. No, like, you take care of them, they will take care of you. And I really love, like, with patients, introducing them to dental things. Like, so many patients have been introduced to interdental brushes thanks to me. Love that for me.
Right,
And then showing them with the mirror how to do it. I think just bringing the patient in and not just bringing them in, sitting down, treating them and letting them go walk out the door, like, changing habits is so
right,
important. And I think people end up taking their health more seriously. They're more in tune with their dental health. They look forward to dental visits. Like, obviously, we're dentists, we stick people for a living and get them numb. But like, when patients are, happy to come to appointments and learn and talk about, oh yeah, well, I bought that TheraBreath that you told me about. Well, what about this? Well, what toothpaste is best for this and that? You can have those conversations with them. That has a trickle effect. They may go home to dinner with their wife and talk about it or tell their wife the things. And I think it just really has an impact when you respect patients and try to meet them where they are and not just focus on them as like a patient and focus on the care.
right. Well, listen, everything so far you're saying, I 100% agree with. The last soapbox item, though,
Okay.
I want to tread carefully
Okay.
because you are somewhat of an influencer, right? You have a following to a degree,
Yeah.
right?
Yeah.
And I've already kind of laid out how I love how you're doing.
Thank
So
you.
my criticism, is definitely not against you.
Yeah.
And maybe I'm just showing my grays here, but so much of our world, especially with Black dentists,
Mhm.
seems to be going this influencer route.
Yeah.
So many are just dancing, so many are just wearing bikinis,
Mhm.
so many are doing everything but dentistry.
Yeah.
right? Or they're coaching you on how to be a great dentist, but they themselves haven't showed a resume of casework to demonstrate that they themselves are a great dentist.
Right. That's right.
How are you balancing the pressures of building a brand,
Mhm.
but maintaining an integrity? And what is your opinion, if you mind sharing, of some of the more extreme versions of what we're seeing, especially our Black dentists exhibiting on social media?
Oh man, I think that so this whole social media thing was never in the cards for me. I literally just graduated dental school and had my first week of work, and I'm like, yeah, I'm a dentist finally. And by Friday, I'm like, that's it. Like, wait a minute. I mean, I'm fulfilled, I'm glad, but like, what's going on? So, there's TikTok, and I just thought to myself when I was in undergrad, telling myself I'll never become a dentist and all these bad things. I never saw somebody like me who was like, just themselves, like not this perfect straight A applicant, but like they grinded and they did what they had to do. So I was like, I'm gonna make a page and I'm gonna encourage the next generation of Black dentists. Like you can do it. Like, you don't see a lot of us, but we're here where we grew up the way you grew up, all that. So then it becomes, okay, brands reach out, Colgate reaches out, and I'm like, oh wow, this can be a thing. Like, and I think understanding that, again, money and influence and connections can really impact how you present yourself. And I am really, really big on staying grounded in who I am, and what I stand for. So I'm not gonna take a brand deal from, Teeth by Tisha. I have to pull her out again, right? Like, let's just say, let's say Teeth by Tisha had the bunny, and she like, Dr. Davis, I'm selling the toothpaste now. Drop a little TikTok for me. No, because I am a dentist in real life. I have a license in real life. I dedicated years in real life. So I cannot represent a brand or a product that I don't believe in. Like for example, oil pulling is a big example. That was on TikTok and people thought they could oil pull their way out of gum disease. You can't. Okay. So I'm like, well, all I see is big influencers talking about it, or like maybe a hygienist here or there that's kind of like gray about it. Like, oh, I love it. It's great on me. But like, you're a hygienist. Obviously, you know how to take care of your teeth. You're talking to people who don't even pick up a toothbrush every day and telling them just to oil pull their way to health. So I'm like, well, let me enter the conversation as someone who can say yes, essential oils have lots of oral health benefits. They have overall benefits, but they can, be anti-inflammatory. I researched papers and looked at it and things like that. So I can give you the good part of oil pulling, but I can also give you a reality. Like, just because you buy this, you are not gonna not need a root canal anymore. Okay. So everybody that's telling you that, that's just not a reality. It's not been proven. I haven't seen that in the literature. You know what I mean? So I think that as far as big dental influencers, like I said, it's a lot of before and after. And I think like I want to say like hip hop and like entertainment culture makes it this big thing of like getting a bag and fixing your teeth, as Cardi B would say. And people want to connect to that. So they're like, oh, how can I be a dental professional, but also attract the masses using that kind of marketing strategy? And I think I get it, but I think that it sets unrealistic expectations for patients sometimes. And I think that it's not cool to be honest. Like, it's not cool to tell somebody you need to floss every day, like it's not cool. No one wants to talk about that, but they want to talk about the veneer case. That's more interesting. So I think I know that I have a good personality. I can kind of bring some comedy and lightheartedness to it, but also still find a way to like get my point across and never lose the fact that like I'm serious and this is my profession and this is the truth. Every implants are great, but everyone's not an implant candidate. Here's why. And people don't know that. And I think it's important for that to live in the cyberspace amongst all the veneer texts and oil pulling and all that, crazy stuff.
Right. See, and this is what I love about talking to people like you, right?
Yeah.
You're also in a similar specialty and professional track as I am. You seem to have this very well balanced and grounded, as you said. You've been able to stay very grounded, despite you have a good reason to flex because you've done a lot, right?
Thank
So if you wanted to, you could,
you.
but you've stayed grounded, and I so appreciate that. And as a father
Oh,
of two daughters, it's
thank you.
beautiful to see, not that either of my daughters wanted to go to dentistry, and maybe they would have seen you early on
Oh
rather than
yeah.
me doing. But
Oh, I appreciate it. That's awesome.
but so we'll wrap this up. But I so appreciate you coming on, Dr. Aierress
Mhm.
Davis. And I know we had talked, behind the scenes of doing an Ask the Expert mini series, little
Oh yeah.
short videos, because I know that you're knee deep in that literature right now,
Oh yeah.
right? So it makes no sense for me to go to a periodontist that's been working 20 years, doesn't remember a paper, right? Because they've been disconnected. You know
Yeah.
all the current and the classic literature. So I want to pick your brain. So one of these days, I want to ask you, hey, tell me about Game. Tell me about
Yeah.
Gem 21. Something for the nerds on this that listen to
Oh,
this channel,
I'm a
right?
big gym girl, by the way. Love
Okay,
Dr.
okay.
Lynch. Call me. I'll do that brand deal with Dr. Lynch any
Yeah, there
day.
you go. There you go. Um, So I so appreciate you coming on, but before we leave, are there any parting thoughts that you want to leave with our audience members?
First of all, I want to say thank you for having me. This is long overdue. I am open whenever you need. You know how residency is, so life is just crazy. But on the other side of this, I'm excited to collaborate and work with you and learn from you, and your wealth of knowledge. So I'm really, really happy about that. But any final words I would say is just, stay true to yourself. I think that's really important. And as it pertains to patient care and as it pertains to gum disease and periodontitis and all the things, just understand that your mouth is the gateway to your entire body, and oral health is overall health. And it's okay to get multiple opinions. Dr. Davis may practice different from Dr. Horton, and I may do an approach that he may not do for whatever reason. It's okay to kind of, feel the waters and go with your own judgment, but don't let one like poor dental experience keep you from taking care of your health and maintaining your health. So dentists are real people. We're human. We make mistakes. We're constantly learning. Any dentist who stops learning is not a good one you should go to. Like it's a lifelong process. And we're practicing dentistry. So some of us have it all together on some days a procedure we've done 500 times it goes down, where in a handbasket. So I just say, just give dentists some grace. But if there are any future dentists out here, I would say give yourself grace along the journey, be yourself, and it'll all fall into place how it should.
Beautiful words. Listen, we're gonna have you back, but tell everybody where they can find you. Because I follow you on Instagram. I'm like,
Yes.
I tried TikTok, but I'm a little too old to really be into it. But tell everybody where they can find you.
So I'm pretty much on all social media platforms at Dr. Air Davis. So Draier Davis. I'm on Instagram, of course, TikTok here and there. TikTok's a little bit more, let loose.
Yeah,
Um, and then I'm really trying to corner Instagram and be consistent there and have some videos that are more educational and that can live there for a long time so people can look up, what to expect for a sinus lift and how do I know I have gum disease and that kind of thing. So yeah, you can find me in all those places.
that's what's up. Well, listen, Aierress Davis, you have quickly become one of my favorite people, even though I thought the world of you before. I think that much more of you now. But we are going to bring you back so
Yes,
we can ask the expert and get some of your current day expertise on a lot of stuff dentistry.
love
But
it.
thank you so, so much, and I look forward to talking to you soon.
I'm honored. Thank
All right,
you.
take care.
Bye, y'all.
All right, let us stop recording. Beautiful.
That was great.
Thank you for listening to this episode of Truth Be Told. The opinions on this episode are just that, our opinions. Please consult your dental professional before taking any action with your dental health. If you have any questions about anything you heard on this episode, please contact us at Real Dentist with an S. That's REAL Dentist with an S at gmail.com. We would be very happy to return any message that we receive because we love the communication that we have with our listeners.